Hi, my name is Angelica. This is my ID, room scanning. You can sit on that. Okay. Hi, my name is Angelica, and this is N190 physical assessment. My patient's vitals are as follows. Temperature is 97.2 degrees Fahrenheit, tympanic root. Heart rate is 70 beats per minute, equal pulse. Respiratory rate is 16 breaths per minute, even and unlabored. Blood pressure is 120/80 millimeters per mercury, seated right arm, and OT sat is 98% on room air. On the Snellen chart, the patient's vision is 20/20 on both eyes. The patient was asked to stand 20 feet away from the chart and read each line from left to right. Hi, my name is Angelica. I'm going to be your nurse today. Can you tell me your full name, date of birth?
Brandon Camarilla, March 1973.
Okay, and Brandon, do you have any allergies to food, medication, environment, or animals?
No.
How are you feeling today?
Happy.
Are you happy every day?
Yes.
Are you in any pain right now?
No pain.
Okay, can you tell me your full name again?
Brandon Camarilla.
Do you know where you are?
At the hospital.
Do you know why you're here?
General checkup.
And do you know what year it is?
2022.
Okay, perfect. When was your last bowel movement?
This morning.
Can you describe color consistency?
Soft and brown.
Okay, is that normal for you?
Yes.
Okay, and can you tell me the last time you urinated?
10 minutes ago.
Any blood in the urine, burning sensation, frequency, hesitancy?
No.
Okay, great. All right, I'm gonna start my assessment. So first, I'm gonna be looking at your skin. Patient's skin is light brown and uniform. Tattoos are present. There's no lesions, no rashes, and no skin breakdown or pressure ulcers. Now I'm gonna be palpating for temp. All right, patient is warm to touch, slightly moist. Okay, I'm gonna be looking at your head. So skin is nice and intact, even distribution of hair and no infestations. Okay, great. And do you wear any hearing aids?
No.
Okay, great. Turn that way for me. I'm gonna assess your ear. Ear canal is pink, minimal cerumen and no drainage and no skin breakdown behind the ear. No skin breakdown behind this ear. Ear canal is pink, minimal cerumen and no drainage. Good. Now I'm gonna be assessing your nose. Touch your head back for me. Okay. No deviated septum, no drainage, no obstruction or bleeding. Good. Do you wear any dentures?
No.
Okay, I'm gonna assess your mouth now. Oral mucosa is pink and moist. Gums are not swollen or bleeding. Teeth are white. Can you lift your tongue out for me? Frenulum is midline, tonsils +2. Good. Can you stick your tongue out for me? Move it left to right. Okay, can you smile? With teeth? Frown? Puff cheeks? Raise your eyebrows? Good, perfect. Now I'm gonna be checking your gag reflex. I'm gonna put my tongue blade in your mouth, say ah. Okay, soft palate rises with the uvula staying midline. Okay, I'm gonna have you sip on this water. Okay, swallow. Any trouble swallowing?
No.
Okay, great. Now I'm gonna be assessing your sense of smell. I want you to close one nostril, yep, and then close your eyes as well, and then let me know what you smell right now.
Strawberries.
Okay, good. And then cover the other nostril and tell me what you see right now.
Peaches.
Okay, good. Sorry about that. Okay, great. And then I'm gonna be assessing your trapezius. Shrug your shoulders for me. Okay, release. And then now I'm gonna add resistance. Shrug. Good. Okay, equal or symmetric strength on both shoulders. Good. Now I'm gonna be assessing your eyes. Here we go. Okay, I want you to look straight ahead. All right. Briskly, briskly, briskly consensually, briskly consensually. Okay, you doing okay?
Yes.
Okay, and follow my pen with just your eyes. I'm gonna put it 4 inches from your nose. Okay, good. Accommodation is present. Great, you're doing okay. Here we go. Follow again with just your eyes. Okay, good. No nice diagnosis present. Good. Next, we're going to be assessing your neck. So skin is intact, no bruises or enlargement that are seen or noted. And I'm going to be touching your trachea. Trachea is midline, swallow for me. Good. All right, I'm going to go behind you. I'm going to be assessing your thyroid. Okay. All right, can you swallow for me? Good. No enlargement or goiter present. All right, now I'm going to be gonna be doing your lymph nodes. I'm gonna turn you just a little bit more. Yep, here we go. Good, perfect. All right, so we're gonna do preauricular, postauricular, occipital, retropharyngeal, submandibular, submental, superficial cervical chain, good, deep cervical chain, and supraclavicular. Okay, good. I'm just gonna pinch the skin right here. Okay, no tenting noted, and then I'm gonna also palpate for your carotid pulse. Okay, that's present. Okay, pulse is present +2 bilaterally. I'm gonna check JVD. I'm gonna have you lay on the bed for me. Thank you. Okay, and then I want you to turn your head that way for me. No JVD noted. The patient is at 45 degrees. No JVD noted. Okay, good. And then I'll have you sit back up. Okay, you can sit right there. Yep. Okay, next I'm going to be assessing your upper extremities. So skin is intact, no skin breakdown. Skin color is uniform and light brown all around. Okay, good. Patient has tattoos. Now I'm going to be palpating for temperature. Warm to touch, slightly moist. Okay, good. And then I'm also going to check edema. And then put your hands right here. Thank you. Good. No edema. No edema noted bilaterally. Good. And then now I'm going to be checking your brachial pulse real fast. Okay, +2 bilaterally. And then I'm going to turn these. Checking your radial pulse +2 bilaterally. Good. Can you squeeze my fingers? Okay, good. While I'm doing that, I'm also going to be checking your cap refill on each hand. Less than 3 seconds, less than 3 seconds. Good. And then do this for me. And then flex, extend. Bring your arms out. Yep. To the side, up and down. Okay, patient has full range of motion. Okay, you doing okay so far?
Yes.
All right, now we're gonna be moving on to your reflexes. I'm just gonna clean my hammer. All right, so I'm gonna grab this. I'm just gonna grab you can relax, okay? Good. Good, and I'm gonna do your tricep. You relax. Right here. Okay, and then put your hand here as if you're about to shake someone's hand. Perfect, but you can relax them, good? All right, and do you have any history of knee surgery?
No.
No, okay. Okay, good, all right. All right, next I'm gonna be assessing your chest. So first I'm gonna be inspecting, if you can sit up for me, good. Chest is, you can sit up. Chest is symmetric, and there's minimal muscle development. There's no surgical scars, no skin lesions or rashes present. Okay, I'm gonna get my stethoscope. All right. Okay, so first I'm gonna be listening to the possibility of bruise. Okay. You doing okay so far?
Mm-hmm.
Good. Use the bell side. Okay. Take a deep breath. Okay, and now I want you to release. Hold your breath. Release. Okay. Hold your breath. Release. Okay, no bruise noted. Now with the diaphragm, I'm going to be listening to your apical pulse. I'll have you lean forward a little bit. Good. I'm going to put it on the 5th intercostal space, mid-clavicular line. While I'm doing that, I'm going to also palpate your carotid. And I'm going to be listening to your apical pulse for about a minute. Okay. No pulse deficit noted. Both are 70 beats per minute. Okay, next I'm going to be listening to your heart sounds. So starting in the right sternal border is going to be apical, 2nd intercostal space. S2 is greater than S1, okay. And then pulmonic is going to be on the left sternal border, 2nd intercostal space. S2 is greater than S1. Next is going to be Erb's point, 3rd intercostal space, left sternal border. S1 is equal to S2. And then tricuspid is going to be left sternal border, 4th intercostal space. S1 is greater than S2, and then lastly is mitral is going to be left sternal border on the 5th intercostal space, mid-clavicular line. S1 is greater than S2. Okay, good. All right, so we're moving on to your lungs now. So I'm going to place my stethoscope in 6 different places. Just take a deep breath in and out every time I place it, okay? Breath in, out. Good. I want you to raise this hand for me. I'm gonna be checking your right middle lobe, mid-axillary line between 4 to 6 intercostal space. Okay, no adventitious lung sounds. Okay, and then I'm gonna have you sit right back down here with your back towards me. Yep, and then I'm gonna turn you a little bit. That's perfect. Okay, you can relax this arm. Now it's gonna be 8 different places, okay? Take a deep breath in. Okay, no adventitious lung sounds bilaterally. Good. While I'm having you there, I'm gonna have you stand up for me. I'm gonna move the chair, and then I want you to remain right here, facing that wall. And then I'm gonna turn you, okay? Next, I'm gonna be checking for respiratory expansion. I'm gonna put my thumbs on T10, squeeze a little bit, pinch a little skin, breathe in, deep breath. Good, release. Okay, symmetric lung expansion, good. While we're here, I want you to keep your hands to your sides, feet together for me, please. Okay, and then I'm gonna be testing for Romberg. Patient does not sway, so it's negative for Romberg, and I did that, having the patient do that for 20 seconds, closing eyes. Okay, negative for Romberg, good. Now I want you to cover one ear. I'm gonna whisper something, and you're gonna tell me what it is. Cat.
Cat.
And during this time, I'm gonna be 1 to 2 feet away from the patient. Cover the other ear. Dog.
Dog.
Okay, perfect. All right, I'll have you face the television for me, okay? And I want you to just walk normally to the end. Perfect. Turn around. Now do heel to toe, right here. Yep. Good. That's perfect. All right, I'll have you sit on the bed because we're gonna be moving on to abdomen. All right. And I'll have you lie down for me, please. Lie flat. Good. Okay, so based on my assessment, patient has no surgical scars, there's no pulsations that I see, no lesions or bulging masses. And now we're gonna be listening to your bowel sounds. Good. Okay. Are you in any pain right now?
No pain.
No? Okay. Using the diaphragm, I'm gonna start right lower quadrant. I'm gonna be listening for a full minute. And if it's absent bowel sounds, I will be listening for a total of 5 minutes. Okay, on average, I heard 20 gurgles. Now I'm gonna be using the bell side to assess for any bruits on both sides. Okay, aortic, renal, iliac. No bruits noted, good. Now I'm gonna be percussing next. Starting again, right lower quadrant, doing all 4 quadrants. Tympani in all 4 quadrants. Then I'm gonna be palpating, let me know if you feel any pain or tenderness, okay? Any pain?
No pain.
Good. All right. Now moving on to your legs. Skin is intact, hair is distributed evenly, no skin lesions. I'm gonna check the feet, bony prominences, there's no skin breakdown. Good. Now I'm gonna be palpating for temperature. Yep, warm to touch and slightly moist. Next I'm gonna check for edema. No edema noted. No edema noted bilaterally. I'm gonna check your cap refill on each foot. Less than 3 seconds. Less than 3 seconds. Good. I'm gonna be testing strength. Push against my hands. Pull. Good. And check your pulses as well. Popliteal. +2 bilaterally, and then your dorsalis pedis. +2 bilaterally. Good. Can you rotate your ankles for me? Okay. And then can you bring your knee to your chest? Yep. Other one. Okay. And take your shin and then drag it across the opposite shin or your heel. Correct. Good. Do the other side. Okay. Perfect. All right, let's swing your legs back. All right, and you're all done with your assessment. Thank you so much for your time.